Hello and welcome to Sleep is My Waking Passion, the podcast where we get real about sleep and how it shapes your life. I'm Dr. Allison Cole, a triple-boarded pulmonary critical care and sleep medicine physician who's learned to thrive despite having chronic insomnia. And now I'm here to help you do the same. Hello, everyone, and welcome to another episode of the Sleep is My Waking Passion podcast. You know who I am. I am going to introduce to you today Dr. Monica Mallampalli. She is an amazing human that I was able to connect with at Sleep 2024. And literally, we had like a really intense conversation at a random sponsored event. And I was like, I got to talk to this woman. I have to have her on the podcast. I hope she says yes. And Monica, I'm so glad after all this time we're able to connect. This is super cool. You're one of my guests for season 6. And it is so fun to watch the evolution and the conversations unfold. So Dr. Mallampalli is essentially a PhD. She was a bench scientist to start and found herself with a natural inclination toward really being interested in women's health. So she did work at the NIH. She was in science policy for a bit, and then she navigated away from that, where she then moved into really being an advocate for women's health, followed by her most recent role, which is still advocating for women's health, but in a different way. She's now CEO of the Alliance for Sleep Apnea Partners, and she has an amazing story and journey to share. So we're going to take you through that because you're going to be learning all about why the health of women is so important, how it really has not been emphasized as much as it should be, and how you might hear something in here that sparks an interest in your own health and changes the way you view your own health. I'm talking to the ladies here. It's not that it's not important for the men. So if you can suspend your disbelief and still hang out, guys, and I mean the guys in the group, this will relate to you because if you have a woman in your life who's sort of neglecting their health, you can be the advocate for them, even if they may not initially be willing to hear the story. So I encourage anyone who's listening, someone in the healthcare field or outside of the healthcare field, give this story a chance because more likely than not, you're going to learn something and I'm going to learn with you. So Monica, thank you so much for donating your time to this cause of really improving sleep education, but also the education of women when it comes to their sleep health, to their general health. So I guess I'd start by kind of asking you, how the heck did you get involved in women's health? Like what drove that passion?
Yeah. First of all, thanks for having me here today, Allison. And I really enjoyed our conversation when we first met. So I'm delighted to be here today. How did I get involved in women's health? So I actually had a mother who suffered from chronic health condition. She had heart disease her life. And I saw through her struggles. I grew up in India. And I knew that even back then, I was very much encouraged my mother to enter the health field because she felt she didn't get the treatment or the care that she needed. She was a lawyer by profession. She worked hard, but I saw day-to-day struggles. So weekend comes, she was just would rest. And so part of that drive to get into healthcare, I was very much interested in science. I wanted to get my PhD, and that's how I came to the United States 30 years ago to attend grad school. Still, the women's health was always sort of back of my mind. I was going through my education and training. And several years later, like you mentioned, I did my postdoctoral work at Johns Hopkins, ended up at NIH. And at this time, I was thinking, I want to do more. I was not quite happy being in research, but I felt like I needed to be out there talking to more people, doing something, and realized that I had passion for advocacy. But right before then, I did get an opportunity to work as a science policy analyst at NIH. And that opened the whole world to me about policy and how things happen, and then realized that I had a passion for advocacy. And that's what led me to my next job, which was at the Society for Women's Health Research. Unfortunately, my mother never got to see what I did because a week into my job at the Society for Women's Health Research, my mother passed away. So my mother never really got to see what I did. But that's something that drives me even to this day because, again, knowing that there are more women like my mother who suffer every day, who don't get the help that they need. I do want to mention one thing that you said in your introduction is health of women. And I think that is so important to say it that way because for many years, when we would say women's health, automatically people would assume it's reproductive health. And women's health is not just the reproductive health. It's everything. It's from head to toe. It's about women's brain health, heart health, gut health, kidney health. So anywhere you look, I think we have to always take the full picture along with the reproductive health. And we can talk more about that if you want. A bit of history on women's health as well.
What I wanted to know from you too, if you wouldn't mind, is I'm going to assume, and if that's a wrong assumption, that's okay, right? I'm here to ask questions, but your mom, was she getting her health care in India?
Yes, she was.
Okay. And I'm just curious if, if you compare the culture in the United States to the culture in India, it sounds like there's some similarities. Like my guess is that perhaps, for lack of a better term, women's health, but not just women's reproductive health, it sounds like even in India, that was just not as high a priority in terms of women getting the care that they need, in terms of recognizing heart disease and getting the interventions that they need to maximize their longevity, and also the association between sleep apnea, et cetera, and other chronic conditions. So I draw some parallels there. Is that a correct observation? Are there similarities and nuances you want people who may be listening here in the United States who are unfamiliar with how the healthcare system works in India? What would you want them to take away?
I think the healthcare system in India back then, and I'm talking about, many years ago, was definitely not at par with what we had in the United States, right? And I think part of the drive for me to even come to the US was to see this is where the research happened. This is where everything was going on, that I wanted to be here and learn more. I will tell you another very interesting anecdote. So I came here as a bench scientist, right? So I'm working in a lab. Was not as exposed to the healthcare system. But eventually, when I did join Women's Health group, this was at the Society for Women's Health Research, I came to realize that until 1993, women were not included in biomedical research. And that, just knowing that impacted me quite a bit. So now looking back, I don't think my mother had a chance. If in the United States, until 1993, women were not included in biomedical research, there were a lot of assumptions that were made back then, before then, that everything was the same between men and women, let's say male and female, except the reproductive health. A lot of assumptions were being made in science, and women were not studied. And there are reasons for that, for whatever those decisions that were made. I think my mother never stood a chance, if you think about it. So here the changes were happening. This was right before I came to attend graduate school, and I did not know about any of these things. I learned about all these many years later. So I think coming in as a scientist into the field of policy and advocacy, and just understanding what had been happening here that I did not know being in an academic institution, that all of these things, because again, being in the surroundings where we were not having the access to understanding the policy situations, I had not even heard about this, right? So I think part of that takes me back to knowing that, my mother, again, never stood a chance, for where we were.
Really, really, really important point, because you came from having grown up in a sort of different environment, coming over here to grad school. And again, it's the promise of, being able to, what are you going to learn in the U.S. scientific system, let alone the healthcare system? But, and then discovering, oh man, they may be at the time, if we go back 30 years ago, maybe more advanced than what they had in India 30 years ago. But here you come along and you're like, whoa, we're still
we didn't even
really, really behind. And this is
Yes.
allegedly, supposedly, one of the better healthcare systems out there. I'm going to say that that's now debatable with all the changes that we've had. That's a completely different discussion in terms of how our structure is. But I can say in terms of the educational perspective, that was also very mind-blowing for me, being a kid who did. I grew up in New Jersey. I had these big dreams of going to be a big bad doctor, and had this in my mind that I was going to be a clinician and I was going to really affect and change the lives of many patients. I do believe that part of that dream certainly was realized. But also my eyes were opened to some of the deficiencies that as this, I'm like shiny, like a bright new copper penny. And then I've gotten tarnished over the years. I would say that though, you wear the lines on your face as we age, because we have wisdom behind those lines. But certainly,
Absolutely.
really that disparity, it's great that we can have a discussion on it coming from the optics of once being more naive.
Oh, no, absolutely. I agree with you on that. And I think my eyes have opened. And I also think about, I have 2 daughters, and it's about my health. It's about the health of my daughters, that keeps me going every day. So hopefully we will make that change. Our eyes have opened, and we'll continue to, advocate for our family, our kids, and also other women.
Fellow girl mom, I got 2 little ones too. I think God gives strong, empowered women girls so we can raise them to be strong, empowered women. That's my story, and I'm sticking to it.
I'm with you.
Love to hear about your journey to the Alliance of Sleep Apnea Partners, because I know that journey is going to be super educational for the ladies listening. So please take it away.
Sure. So when I came to the society, and I've worked in many disease areas, because the work that we did there was to raise awareness of the biological differences between men and women, right? So like I said earlier, it's beyond just the reproductive health. So we were trying to, raise awareness, saying that there are biological differences between women and men, whether it's cardiovascular disease, whether it's musculoskeletal health. And during that time, there was a conversation about sleep health, which we felt was very much ignored. And so I attended I believe the sleep conference in 2013, just to have an idea of what the conversations were like, who's discussing women's health, and realized that there was hardly anything that was happening. I think there was one session. So we came back and said, and I got to network with a lot of the physicians, researchers there, and they all felt that there was a need to talk about, women's health. And then we decided to do a roundtable discussion on this topic. So I invited all the leading physician researchers from the sleep field and had a roundtable discussion on just sex and gender differences in women's health. Why my eyes opened up to that discussion. And during that time, I realized I had symptoms of sleep apnea. I had my child. I had, just 2 years before, I had gestational diabetes during that time. I have no history of diabetes in my family, so that was a surprise to me. And as I'm listening to the conversations, I start to tick off all the symptoms, going, wait a minute, I think I have all these symptoms of sleep apnea.
Tell everyone the kind of symptoms that you had. What kind of symptoms really stuck out for you?
Yeah, the breathing was the most important one. I've always been a mouth breather. And this is something my mother had pointed out, because she was very worried that I might have, again, out of her own fear, that I might have some heart-related issues. She tried to do her best to have me seen by physicians, and everybody said, oh, no, she's fine. Now, looking back, I was always a mouth breather. I had trouble. I was always, trying to catch my breath. I went through a lot of hormonal issues, before the birth of my child. And so they were all adding up. And I also, this was a few years before, I actually had a completely unprovoked seizure middle of the night. It was a grand mal. And my husband says that I had stopped breathing. And I had, again, no idea, where this came from. And of course, that took me off to a whole different journey, because that was like, oh, you probably have something going on with your brain. Now I can connect all the dots, right? And I probably stopped breathing because it was probably because of sleep apnea.
I just want to clarify, if someone's not making that connection, basically when your airway closes off and you're not getting proper oxygen, you essentially cause an issue with blood flow to the brain. Your brain is not seeing the same levels of oxygen, and that can be a trigger for seizures.
Yes. And of course, having seen a neurologist and going through all the process, not once there was a conversation about sleep apnea. Not once it was brought up that was there something like that happened. It was always pointed out, well, you're having hormonal issues. And so this is what is going on with you. And why don't you go talk to your OBGYN? And, the OBGYN would say, well, talk to your neurologist about the seizure aspect. We'll deal with, anything that is, gynecologically that is happening. So it was this back and forth. So it is very painful for me to say this, but being somebody who's trained as a scientist, and if I'm unable to get the information that I need, what does it mean for an average woman trying to understand what is happening with her health? So I just want to point that out, that it was very difficult for me to get the answers back then. So when I am moderating this roundtable discussion and I start to hear all these symptoms, and I'm connecting the dots at this point going, wait a minute, what is happening? And that's when I took charge. I found a sleep physician, went for sleep testing, found out I had mild sleep apnea, but I will not say that my symptoms were mild. I mean, I still had the daytime fatigue, tiredness, and during all of this time, I'm still commuting to DC every day. It was hard. It was hard. But eventually I got the treatment. I got CPAP, which again, I had a very hard time adhering to, because I was, again, always been a mouth breather, right? But I will tell you this much, that after using CPAP for several years, so I went off of CPAP for a little bit because I just couldn't handle it. But there were not that many options back then. This is 10 years ago. But a few years later, I came back because I had no other option. I'm like, I have to make sure I adhere to the CPAP. But once I did not have any of those lightheadedness, the aura, or some of the things that I would experience before. So I can say that I've not had any seizures or anything while I was using the CPAP.
You have just hit on some very major points, especially specific to women. So I just want to highlight them because it's so key. What Monica's saying, she knew, she was suspicious, something's going on, all my symptoms, I'm a scientist and I'm putting all this stuff together just like any clinician does. And quite frankly, you don't need to be a physician or a nurse or anybody in the healthcare field to start to say something just doesn't feel right in my body. And I'm hearing that these symptoms are kind of merging for me. I think the risk is quite low for getting assessed. Either nothing invasive is happening to you. It's really a monitoring of your sleep. I'll spend the time to talk about it now. It's very convenient to get some testing in your home. I just want to point out that sometimes in more mild cases, which is more common in women, yes, by the way we define mild, it can be missed on home tests. So sometimes the in-labs are a little bit better. There's also for less expensive cost than an in-lab, you can do home polysomnography or multi-night testing, though there may be an additional cost because it's not really mainstream or recognized right now when it comes to insurance plans and what they are able to reimburse for or willing to reimburse for some of the sleep apnea testing that we do. That's one point. The second point is how we define mild, and I use that in air quotes. It's really a way of saying, okay, well, our current definition, which may change in the future, is really based on how many events do we see. And by events, we talk about pauses in breathing for about 10 seconds. We talk about drops in oxygen levels with a reduction in flow. Basically, we're trying to breathe and the flow is really diminished up here. And we're seeing an associated 3 or 4% drop in oxygen levels, depending on the criteria you're using. And we say, okay, if it's happening more than 5 times an hour, oh, that's important. There's also more subtle events that are that sometimes are picked up. Home sleep apnea testing, there are varying points among sleep specialists about the importance of these more mild events on home testing. I still account for it personally, though I've heard some people feel like there's an overestimation of what we call respiratory effort-related arousals. My airway, my oxygen seems okay, but I'm having a little arousal from sleep. There's a disruption in my sleep as a result of that. The significance of all of this is and this is something that we as physicians really need to wrap our heads around too. You can't just look at a number and make assumptions about the patient. Meaning mild can look very different in different people. And Monica, you're the classic example of where a number doesn't define you because part of the difficulty, yes, it is extremely difficult to say, I've got to get used to a full face mask. I've got to get used to CPAP. And it's weird because you've lived your life without it. And now someone's saying you have this condition. But would it be fair to say that the word mild may have influenced your motivation a little bit? You had some symptoms, but did it seem maybe less significant to your life initially when you took that break off of CPAP from that word mild? I'm very curious about this because my perception is it could influence.
As a patient,
someone's committed.
Right. As a patient, it didn't matter to me. I was just happy that I had the diagnosis.
All
right?
Fair enough.
Because if I tell people that, I'm breathless, I'm having trouble, and people around me, my family members would say, why are you so breathless? Do you have asthma? And I've been to doctors and everybody said, no, I didn't have asthma. So just knowing that there was a diagnosis and this is possible, it resonated with me. I don't think I focused on the mild as much, but I do remember the reason I wasn't adherent to there's a whole other story to this, and I'll tell you, is I was going through a lot of stressful events in my life back then. This is, work related. And like I said, I was commuting to DC. So this was just another thing that I had to adapt to, which I just didn't have the patience, right? And I'm thinking, just give me something that'll help. And I'm thinking, I'm sleeping fine, right? Pretty much was a blackout. Like I'm sleeping. So now I have to deal with this that's going to wake me up. I can get through this. I did not know that there were insurance criteria. That was not shared with me initially. Although the doctor did say when I came back and I said, I can use this. And he said, well, I have to show that you are able to adhere to this for a bit longer. And at that point, I'm like, no, I'm not going to deal with this. This is just too much hassle for me at this point. So now I understand there is always that initial hurdle of trying to adapt to the CPAP, right? But when I had to come back and use it, when my snoring was so bad that my husband's like, well, we can't even sleep in the same room because it's gotten so bad, is when I said, I have to do something about this. And I forced myself to use it.
That is really helpful information because I was under the assumption that somehow the word mild influenced you. It turns out that was a wrong assumption. But what you did highlight is the fact that there is something to be said for the other aspects of what happens specifically to many women, especially when they're moms and they're working and you throw in a commute. And culturally, in this country or outside of this country, there are often certain assumptions made as to what constitutes a woman's responsibility in the household versus what constitutes a man's responsibility. And right. I would say that's something universally I've seen across cultures. We're the nurturers and we take on a lot of that. And it may be intrinsic to some of our biology, how we respond or how we naturally sort of gravitate toward that motherly responsibility. But it was one added pressure. And while I've thought about that, I think it's a really important point because it may be influencing more of my patients than I initially thought. So I really appreciate you sharing that aspect of it because you're right. It's like a hassle. And initially, your sleep might actually not be helped because only about a third of patients are like, I put this thing on, I'm asleep, I'm magically wonderful. I mean, those are my easy patients, right? And anybody who's listening who's treated sleep apnea patients knows those easy patients. I'm curious because it was around about 10 years ago, but maybe not as mainstream or as commonplace or as modernized as it is now. Did your doctor mention anything about oral appliance around that time, or was that even accessible
No.
or affordable to you at that time?
No. I mean, he did not mention it. All I was told was you have to adhere to CPAP before I say you're unable to adhere to CPAP before I can suggest something else. So that was not even an option back then. And I did not know. I did not know that there was an oral appliance that I could get. I will mention one thing, though, which has taken me a while to get here. I had a lot of sinus issues that was never addressed. When I was in the lab at NIH, I had a severe chronic sinusitis because of a mouse facility in the basement. And I remember going to an ENT doctor and getting treated for that. Unfortunately, his practice closed soon after that. And I assumed everything had cleared. So this is something, again, very interested how some of that has played into my diagnosis, because if your sinuses are blocked and this becomes chronic, it's hard for you to breathe. And turns out I've also had deviated septum. So I think, again, I'm learning as much about my own health, my journey as I go along, and as I'm learning about, sleep apnea as well. So I think there's just a lot of factors, like you said, and I think it starts off with very simple education event by saying, what is obstruction? Patients need to understand where this obstruction can be in your airway. I think it also falls on the primary care physicians to have that discussion with their patients. Okay, you're having trouble breathing or you're having trouble sleeping. Let's start with that instead. And it happens quite often with women that either they're misdiagnosed as having anxiety or depression because we don't talk about their sleep health. And the doctors don't even bring this up. So annoying. If you do that with the pediatrician does that until a child hits 18, right? And then that conversation never happens afterwards. It's assumed that all the college kids are all sleep deprived or kids in high school are sleep deprived. How come we don't follow up that conversation with adult women?
Yes.
It's amazing.
Someone needs to say it out loud. I got to tell you, as somebody who has, suffered with anxiety and depression, I have been able to really work through that. I did take some medication and I still do, just because, I don't know, it's a very low dose. I'm not having any side effects and I kind of feel like it helps me. But I will say that the crux of the issue, I had to unearth that. I did have sleep apnea testing, and I have shared on the show that I've only had one kind of positive test, and that was related to wine at chest conference, in full disclosure, but normally I don't, right? So that's not a major component to it, but the assumption that it's so your female hysteria. I cannot even describe how irritating that is. So don't just chalk it up to, I have stress in my life. And I think a lot of women do, because they're taught, really. You go to the doctor and someone's not asking about your sleep health or not asking about some of these other aspects that may be contributing to you feeling depressed or feeling anxious. Those are not being addressed. And so you just assume it's all in your head. And at the end of the day, we need to kind of take a step back and almost restructure the fact that we go to authority figures, such as your physician or nurse practitioners taking care of you, anticipating that they're going to be dealing with these issues. And when they don't, you just come to the conclusion that was sort of dropped on your lap. And I want you to start taking that back a bit and saying, wait a minute, is there another root cause? And what is that root cause? Whatever it may be. Is it a medical condition like obstructive sleep apnea or insomnia, primary insomnia issue? Is it that you're struggling to deal with your stress? And we need to figure out healthy ways to do that.
I think we cannot just assume everything. And I think that's where we need to start. And this is something we do at Alliance of Sleep Apnea Partners. We want to encourage people to go seek diagnosis. If they think there's something wrong with them, go ask a physician. In fact, Allison, we have a handout on our website. It's a toolkit where we encourage women to use that toolkit, almost like a communication tool with their doctor. So it allows the women to look at on one side lists out the symptoms that they might have for sleep apnea. And if they believe, and it's like a checklist, they can go through the checklist. And if they feel that they meet all the criteria, take that to their primary care physician. And on the backside is information for their primary care. So have your primary care read that information and have the conversation with them, whether they can order a home sleep test or send them to a sleep physician. And we also have in that information, if the home sleep test comes back negative, still insists on getting a sleep study. So don't ignore your gut feeling. If you know something is wrong, just go ask for it. So that's part of what we are promoting is self-advocacy, telling patients, go ask the questions, don't give up, because it's your health. And we all know women are almost like the chief CEO of their home, right? So if your health suffers, then rest of the family's health suffers. So you need to take care of your health and make sure that you're getting the rest that you need, and are able to get again, I think the first step is diagnosis, getting the diagnosis of something and knowing that now you have options, you have treatments, that you can do something about it, and not let anybody else convince you otherwise.
That is a perfect way to end this podcast episode. The only thing I'm going to request from you, Monica, other than seeing your beautiful, lovely smile, hopefully at Sleep 2025, because I will be seeking you out, would be if you wouldn't mind connecting me with the direct link so that any women listening to this, I can put the general link for the Alliance of Sleep Apnea Partners organization, but I would love that specific link so they can go directly to that, particularly if they're tickled and intrigued about looking at their own health after listening to this.
There's one other resource on how women can approach their physicians and the types of questions they can ask. So I'll send you the link to both those resources.
Perfect. Thank you so much for your time today.
And thank you for having me.
Struggling with sleep? Dr. Cole is here to help. Whether you need a comprehensive sleep coaching program, suspect you have sleep apnea, or simply seeking a second opinion, she's available for consultation in New Jersey, New York, California, and Georgia, with more states coming soon. Schedule your free 10-minute review of services today to find out which visit is right for you at AskTheSleepMD.com and start your journey to better sleep with a trusted sleep expert.
Please be advised that the Sleep is My Waking Passion podcast is for entertainment and educational purposes only. It does not constitute medical advice. Always consult your healthcare provider for personalized guidance. For my full disclaimer, please visit AskTheSleepMD.com, and while you're there, don't forget to sign up for my free newsletter. Sweet dreams and happy listening.